Hi, I'm Sheri Hadfield, and I help people in chronic pain to thrive by reducing their pain, exhaustion, and depression so that you can take the freedom back to fully enjoy relationships, careers, and hobbies. So, today, what I want to talk about is what is chronic pain? And I think to start with that, let's talk about what is acute pain. And acute pain is if you were to stick a tack into your hand, there would be a chemical, several chemicals that are released and go up your central nervous system to your brain, and your brain then sends back a pain signal. And the pain signal at that point is it's a very healthy situation where it's telling your body that you need to stop what you're doing, rest, and relax. And as your body heals the wound, your pain goes down. So that's the healthy relationship, that there's pain, and as the healing goes up, the pain goes down. With chronic pain, that's not the way it works. Chronic pain, by definition, is the pain that's left after an injury or illness has healed and diminished. You're left with the pain. And a lot of times, it's considered to be 3 to 6 months after the injury or illness has healed, and you're left with the pain. For a lot of people, it's 3 years, 5 years, 10 years, multiple decades. And it is an all-consuming, can be all-consuming, really just life-changing pain. And then the other things that come along with pain when pain has gone on for years, where you stop sleeping, get depression, anxiety, all of those components that come when you've had pain ongoing for that long. All right, so let me say that chronic pain itself has become a disease, a complex, a syndrome. In the time that I had 18 years of chronic pain, and during that time, they didn't re-diagnose me necessarily, but they would change the name of it. And they didn't really drop one most of the time, they just added. So it would be your injuries, degenerative disc disease, pinched nerve, tilted scapula, okay, those are the same. But it would be chronic pain syndrome. Then they added in myofascial pain syndrome, then central regional complex syndrome, and then central pain syndrome, fibromyalgia, chronic fatigue. So it just added on. So what I didn't want to do is give you a list of 30 different names for the various aspects of chronic pain and the different syndromes and complexes that fall under the umbrella of chronic pain. What I wanted to do instead, and the reason is I'm not a doctor, that's not at all where my interests lie. My interest in chronic pain came because I had 18 years of chronic pain. So I was constantly trying to learn to get out of chronic pain, honestly. I tried to learn about chronic pain for the sole purpose of getting out of chronic pain. Well, I've done that. I'm 90% chronic pain free, and I'm in my second year of that. And so what my interest in chronic pain is helping you get out of chronic pain. So what I did was write out 4 kind of broad strokes of what my studies have shown and what the medical community and the alternative care for chronic pain, when you boil all of that down, what are kind of the 4 broad strokes that they feel like cause or contribute acute pain to turn into the beast of chronic pain. So that's what I wanted to go over today. I feel like it's important to understand the aspects that can cause acute pain to turn into chronic pain. It's good to understand it, period, but I think it can be really helpful I think knowledge is really helpful in helping people break through chronic pain. So that was my goal in doing this, is I think it's good to understand various aspects that could have caused your scenario, and then next steps, or what do you do to get out of it? So what we're going to go over today is, the first one is central sensitization. And basically what I'm referring to here is because there's a whole group of people that fall in this category, that steady chronic pain. And the way I'm going to characterize it is, when your body has gone through the scenario of acute pain turning into chronic pain, it's been trying to send you the signal of pain, which, remember, the role and the purpose of pain is to get you to stop, rest, and relax. And if there is something foreign, like a nail in there, get it out, clean it out, and heal it. Well, it keeps sending you the message, which to me means it doesn't think you're getting the message, because you're not stopping what it wants you to stop, relaxing, recuperating. So very much like if you have a kid and you're upstairs and you can see out the window and something's going to fall on them, raise at the window and yell out, "Move," because you don't want it to fall on them, and they don't hear you, they don't move, so you're going to yell louder, scream, throw, whatever it takes to get their attention. And I feel like that's what happens in central sensitization, is your body, your mind, brain is sending out to you the message to stop. And it obviously feels like you are not getting the message and are not responding appropriately to the message, so it keeps sending louder and louder and louder. So that moves you into a scenario of fight or flight. So the chemicals that are being released into your body, your brain and your central nervous system are all on super high alert. And if you're talking about that's been going on for 6 months, 5 years, 10 years, 15, 20 years, it's a really long time to live in fight or flight. So you're getting cortisol, adrenaline. Those things cause you to constantly be on really high alert. There's no rest, there's no relaxation, there's no recuperating. That's not a environment for your body that is conducive to healing at all. So your central nervous system's been on high alert for a long time, and it makes it where everything now, or many things, cause your pain or discomfort to go up. Loud noises can do it, loud music can do it, certain textures and things that never bothered you before will start to bother you. There are people who you can take a feather and put it on their arm and it feels like fire or burning to them. So the central nervous system has gone so high alert and so oversensitized that the tiniest things you can blow on somebody and it hurts them. So that's what happens in central sensitization, is the central nervous system has been trying so hard for so long that it's on overdrive. The other part of that is that increases the pain signal modulation, so the pain signals can get louder or change. Like, all right, so burning pain didn't get your attention, that didn't get the message through, let's try throbbing pain. Throbbing pain doesn't bother you? Let's move the pain. All of those things can happen in chronic pain, where I have clients where it has moved all over their body, and it's very common in fibromyalgia. So that central sensitization, your central nervous system is in overdrive all the time, and then your body lives in fight or flight, which makes it where your immune system is depleted as well. Not a happy place. Next one, tension. And I've also seen this as stress. I prefer it as tension. I think stress can cause tension, but I also feel like there's a lot of great tools for how to take the jolt of energy that you get a lot of times with stress and turn it around and use it in really, really positive manners that can propel you forward toward your goals. Tension, on the other hand, is a physical reaction where you tighten, like if you tighten your fists or your jaws, like really, really tight, the muscles contract and get tense, and the ability to get blood to flow through your body at that point is seriously jeopardized. and that causes pain. So one of the ways, a sponge. If you have just a normal kitchen sponge and you put it under the faucet, the water can just flow right through it. It fills up, it gets all puffy, and then the water drips out the other side. If, on the other hand, you squeeze it like you would with tension, if you squeeze it all the way a little and you put it under that same amount of water, very little water is going to get through there. And for you, when blood flows through your muscles and your body, that's taking nutrients, oxygen, all types of intelligence and information throughout your body, and now you've stopped that process. And also, there's a part of, as your blood flows through your body, it's also taking toxins and things that need to leave your body, processing that through your body so it can be expelled. And so when you have tension, you stop that process. And when you have tension in several places in your body, you're stopping it a lot. This can cause pain. Oxygen here, there's blood flow oxygenation. I always have trouble with that word. I knew it was coming. And there's also oxygen of a different type, and that's your breathing. And that is, what I'm referring to there is, I noticed a lot with myself, and I don't think I've had any patients that didn't say, I don't think any of my clients, not that I can think of, that didn't say a very similar thing. A lot of times when people are in chronic pain, you shallow breathe. You don't want to live in your body because you don't want to feel what it feels like to be in your body. And so without necessarily consciously making that decision, you start shallow breathing so that all of your breathing comes from about the middle of your chest and up versus your abdomen. You want to be breathing from your abs, from your gut. That's when you get good, full breathing, and that's when you can get restorative rest and relaxation and rejuvenation and resilience, all those words that you really need. A lot of that, when you cut off the oxygen, again, you're putting your body in survival modes, and that is not where you want to be. You want to be in a thrive mode. So when you're in a survival mode and you're just barely, you're almost panting. It's not, and I'm not saying that you look like you're panting, that's the action of it. And so it's like, just get little shallow breath, not what you want to do. Both of these are not places for healing, not environments that really even allow healing. Emotion is the third one. And the first part of emotion is what was happening in your life when you got hurt or injured or illness. And if you weren't aware that you had an injury or an illness that caused the chronic pain, like for me, I got hit. I knew when it started. If that wasn't the case for you, it kind of snuck up on you somehow, it can still very much be important to like isolate when is the earliest that you really know, okay, the pain had moved in and it stayed and then it escalated. And think about what was happening in your life during that time. Did you have a child who was being bullied? Was someone that you love chronically ill? This one comes up more often than I would have thought. A new boss, a new job, a new career, a new boss. Any one of those can trigger a lot of childhood things. So looking at what was happening in your life when the pain started is critical, because it can play a really important role in helping, which is what I care about, in getting you out of chronic pain. So that leads me to emotional pain versus physical pain. This is interesting. They've done a lot of studies that have concluded that your brain activates the same parts of the brain. If you put something hot, so you physically burn someone, it will activate the same parts and areas of the brain as when someone who you love breaks up with you. If you have a boyfriend and they break up with you, it will activate the same areas of your brain as if we were to burn you. So physical pain and emotional pain, although they have differences, they activate the same parts of the brain. They have very similar reactions and responses to parts of the brain. And the brain is the part that I'm interested in helping you heal. There's, I'm sure plenty of you have been told that at times that your pain is in your head. All pain is in your head. All pain starts and activates and is created in your head. And we didn't used to know that, and we do know it now. So it's important that your mind is a very important part of getting you out of pain. And that's exciting. The last one, lifestyle. And by lifestyle, I'm talking about what kind of foods you eat. Do you eat a lot of crap? Are you eating organic, clean food? Were you eating organic, clean food when you got hit? Have you stopped doing that? Do you get plenty of sleep? Were you getting plenty of sleep? So it's looking at the time you got hit, what was your lifestyle like, and what has it become and what is it now? Those all can leave really good clues to, at the time that it started, what role it may have played, and then in trying to reverse it. Can we use some of this to get momentum going the other direction? So here I put food, chemicals, if you have chemical sensitivities, if you're painting all day with really smelly chemicals while you're hurting, it can be sad but interesting to stop that for a little while. And you'll know really quickly. If it helps significantly reduce the pain, you might want to look into a different type of paint for a little while. And a lot of this isn't for life. It's making some changes that get the momentum going back the other way. And it works. So we said food, chemicals, alcohol, sleep, social life, and support system. If you get, all right, I'll use myself here. When I got hit, I had a 3-year-old daughter at the time I got injured, and I had been divorced for a year, and her dad and I did the most amazing job of co-parenting together. We never, I'm not gonna say we always agreed, because we didn't always agree, but where she was concerned, we agreed most of the time. And so he had been diagnosed with melanoma about 6 months or a year before I got hit. And when I got hit, there was no doubt, it didn't strike me then, it was over the next few weeks when the pain kicked in that I was realizing, I started to realize, gonna be like, he wasn't doing well in the treatment at all. And so I started to realize and get really fearful that I can't be in pain. I can't be hurt, I can't be in pain. I'm gonna raise a little girl by myself. That's a very different mentality than if I got hit and my life was in perfect order. There was nothing different going on, and I have a great support system. There would probably be a part of you where if you knew going to physical therapy was no big deal, it wasn't going to affect anything, you might handle all of it differently. And it has a lot to do with the chemicals that your body puts out when you get in stress, fear, worry, concern, all of those. When you move into fight or flight, it's a very different chemical scenario in your body than it is when you have a great social life and you feel really supported by your family and friends. Those scenarios, all of these things in lifestyle can also trigger emotional things that are tied to the type of injury you get. You may have known several people in your lifetime that died of cancer, and so if you get a diagnosis of cancer, that may instantly shoot you into a completely different emotional and chemical response instantly because of what you've seen over your lifetime. So in a nutshell, these are 4 components that are considered to be an important aspect of what causes chronic pain. And my interest in it, as I made clear before, is using tools that that I'm certified in and that I am good at in helping you reverse some of this and get momentum going the other direction, so we can get you comfortable and happy and fully living and incorporated in your body again with joy. I want to thank you for your time and your interest. And if you have any questions or any comments, please leave me a comment below. I really appreciate it. Means a lot to me. And I also am going to be dropping a link below for anyone that would be considering working with me for a strategy phone call. It's 45 minutes complimentary. And it's just for us to, you can tell me what happened to you, what's your chronic pain scenario, what's your relationship with it, what have you tried, what worked, what didn't, and I can tell you more about what I do, and we can see would we be a good fit to work together. Thank you so much again for your time, and I hope you have a great day.